Good morning. I'm going to go ahead and call this meeting to order. I'd like to welcome our guests, Director Garcia, Dr. Klein, Dr. Deol. At this time, I'd like to turn things over to Frank, who's going to walk us through a quick intro, and we'll go from there.
Sure, thank you. So thanks for being here. Just a brief overview how we got to this. The conversation I think have gone on for years, but they were new to me. As Dr. Deol came on with the county, we had discussed the various needs in the county medical examiner's office, which are significant, especially from a financial respect, but it's both new docs, staff, equipment, really a new facility. So it's not a sustainable model as we sit today. It hasn't been a sustainable model for some time. So as he and I were kind of working to address some of that, I had a subsequent request from the state to meet with Director Garcia, which I did, and staff. And the one thing that was really interesting is Dr. Deol's vision and the state's vision really aligned. And so, as I said, and Dr. Deol can speak to this as well, our model just isn't sustainable. And we're always in the issue of losing a doc and then having the same problems we've had. And I would hate to see the county build a facility and then not even be able to use it. Whereas the state has a state-of-the-art facility, uniquely designed for a medical examiner. They have an allocation to expand that, to really have a footprint operationally to take us 30 years from now. And I don't want to speak for them, but also a fellowship program, which I know Director Garcia will speak about, really addressing the issues we face and training docs from the ground up with the hopes of them keeping here. So really a lot of different ways of addressing the problems that we've faced for a long time. And I hope everyone will just see this with an open mind and a discussion, and that's why I wanted them here today, so the board would have an opportunity to hear what this could look like. I think it's what our constituents are asking for, a collaboration with other government to maintain level of service while reducing the cost of government. And this would potentially save us millions of dollars initially and over time. So again, I just hope we can have an open discussion and hear what they have to say and then get next steps. And with that, I'd turn it over, Mr. Chair, to Director Garcia.
Very good. Welcome. How you doing?
Thank you. I'm well. But I need to push the
Yes.
button. It's my first time at a Polk County Board of Supervisors meeting, and I was at Dallas County yesterday, so twice in 1 week. It's lovely to be here. I think this afternoon. I'm Kelly Garcia. I'm the director of the Iowa Department of Health and Human Services. Thank you for having me here today to talk about this potential opportunity. Frank's exactly right. It's not a new conversation, and actually it really predates my tenure. And there has always been a kind of interdisciplinary role here between the state medical examiner's office and the Polk County medical examiner's office in terms of the forensic autopsy work that is done. I'm gonna give us a little bit of background and kind of some of the pathways forward. I do have with me our chief for the medical examiner's office, Dr. Dennis Klein. And so certainly we should give both doctors opportunity to talk about the technical work, but I want us to kind of understand and do a little bit of place setting around the table, as we will, around what we're thinking about at the state level. So I've been in my role now for almost 5.5 years. I came to be the DHS director back in November of 2019, and the governor asked me to serve as the interim public health director in the summer of 2020. We'll all remember that time. And so that's really when I started to work very closely with Dr. Klein around a number of items. One, obviously, the immediate response that was before us during COVID. How did we plan for that emergency response? And then we started to do some deeper work around emergency response planning for other types of disasters. We were thinking about caseloads, which were high in the office. What did that future planning look like? For context, forensic pathologists are some of the most highly trained physicians that exist, and they're hard to come by because they are so highly trained. And so we were really thinking about the strategy around that. Dr. Klein has been in his role for some time. He has a real vision. He has a wonderful team culture, highly trained docs. And my job, as with anybody on my team, is to execute for them, right? To help them get the tools they need to do their work, whatever that is, whether that's social workers on child welfare or a team of forensic pathologists at the medical examiner's office. A core value for our agency is excellence. And we think about that not as perfection, right, but as always striving for what's next and to land that work in the intermittent time with true precision. And so you have a packet before you that explains what the medical examiner's office does and some of their core values. You'll see in that list is quality and excellence. So we are an accredited facility, which is a high caliber, also accredited public health agency, also a high caliber, and that really gets to the core value of excellence and precision around the work. When we think about the national recruitment landscape of this highly skilled profession, again, it's already tight, right? It's a very tight market. There are a lot of postings. For example, we worked very hard to recruit Dr. Deol to our office, which included me being involved to think about what it would take to get him to the state, right? And so you all experienced that in your tenure, and we have as well. Our office's responsibility is, we have some core baseline responsibilities to take on state work. And so anytime a county makes a decision to come offline, of course, it's a state function, right? I mean, it's a government function. And so for cases to proceed, Dr. Klein's office takes on that workload. And that's been some of our history here, right? When you have not had a doctor or not been adequately staffed, then that work comes to his office. So in thinking about that work and thinking about my role in the agency, really what I'm looking for is how do I ensure that I get the right assets, which is workspace, appropriations for a number of FTEs, et cetera, so that Dr. Klein and his team can handle the workload that presents itself to us. What I can tell you, as Frank just said, from a Polk County perspective, is that I would say the same from the state perspective. This relationship is unsustainable as it exists today. It's too hard for me to plan to take over the Polk County caseload given the volume without any runway. And we have seen that in the history of our working relationship. Furthermore, I need to think about what caseload growth looks like for all cases statewide, right? Today, we are already processing autopsies in Dr. Klein's office for the vast majority of Iowa's counties. Johnson at the University of Iowa and Muscatine, both of those go to the University of Iowa, and then here in Polk. So really, we've already got the predominance of a statewide profile. And so this potential partner would bring us even further to that realized vision. Stable staffing, and as Frank mentioned, we have been having conversations for the past year with Des Moines University about a potential opportunity for a fellowship program, which is incredibly exciting because you can see in some of the work that we're discussing with the legislature, hopefully you have seen this, that we have a real vision in the agency around how to build pipelines for clinicians at all levels, but more specifically here, physicians in the state. We have a unique position to be part of that pipeline build in a variety of different ways because we're operating our own facilities and we have many doctors. We have psychiatrists, we have forensic pathologists, we have psychologists. So we're thinking about the role that our agency can take in helping the state further recruit and train their own physicians, clinicians, et cetera. With this additional capacity, and the work that happens right here in our own backyard, also the medical examiner's office is in Polk County, we could do that, right? This vision of a fellowship could come to fruition. In your packet, I'm happy to walk through this in more detail, you can also see physical footprint vision, which frankly, we planned for by ourselves. We had some meetings last summer around that vision because I came forward to the legislature to ask for a special appropriation to expand the physical footprint of our office. The office was tailor-made and designed for the work that our forensic pathologists do, and this expansion is an expansion of that very detailed design. And so it is funded, and we will be breaking ground here soon. Dr. Klein is actually in an all-day planning meeting. He has stepped away to be here with you all. But it is a vision that is live, right? And so we're already kind of built to assume higher caseloads. Dr. Klein will happily walk you through that in more detail should you have question. But really, I think this is around the sustainability. It is always our goal in the entire HHS to make sure that we're meeting the needs of that includes always. And so there would be nothing different here from my perspective. other than to get us over a bridge, which is a transition timeframe, to get to staffing sustainability, and to do that in true partnership. So with that, Dr. Klein, do you have anything you want to say, or just want to be available for questions? He will be available for questions.
I'll add just one comment too, to clarify, the county would continue to have its own county
Yes.
medical examiner, a deputy medical examiner. We would maintain all of our current investigators. So to a certain degree, operations would be business as usual there. So we are not transitioning the medical examiner office to the state, just to be clear.
That's a perfect clarification, and all counties have that, right? So every county has a medical examiner assigning death certificates, et cetera. This work is specific to the autopsies.
Because the difference is Dr. Deol is a pathologist who does autopsies, and a regular, not regular, but a doctor can sign a death certificate, or that gets the information from the death investigator. Is that correct? Dr. Deol?
So it depends on the type of case that we're discussing. If the case is requiring a postmortem examination, whether that be an autopsy, an external exam, a forensic pathologist performs that exam, whether at Polk County or State Medical Examiner's Office, and then they sign that death certificate. There are other cases that come to the county medical examiner, and that's the same with Polk County and any of the other 98 counties, that don't require postmortem exam, but they do require physician's oversight to do a medical record review, and they'll sign death certificates with that, for those cases, without a physical exam of the body. In those cases, in the latter example I described, that physician does not need to be a forensic pathologist. It can be argued that in a county the size of Polk County, I can see the benefit of a forensic pathologist reviewing those cases as well. I think every one of us forensic pathologists had the experience at some point of reviewing a death certificate or cremation permit and catching something that maybe a previous physician with different specialty may have missed dynamics that elevate the case.
Thank you. So, can we ask questions now?
Absolutely.
Okay. Kelly, thanks for being here. I appreciate it. I know you're busy. When did these discussions start? I know you and I, we met several years ago, and we didn't have a medical examiner. We started talking about maybe having a partnership, and we had lots of discussions. So when did these relevant Polk County discussions start? Why you're here today, basically?
Because we were receiving, we first started having them again in earnest when Dr. Deol left us, because it left a hole for our staffing levels, and we worked quite hard to recruit him, and I needed to go back and talk to the governor's office and the Department of Administrative Services around recruitment bonuses and a variety of other things to kind of shore that up on our side, and then get back to thinking about how we maintain staffing levels. We are also, you're still sending cases to us, right? So that interdisciplinary work on how we staff, I can't remember actually if Frank reached out to me or I reached out to Frank, but had some questions from the legislature. There are a number of bills that intersect with this work that are traveling through right now, including who can sign off on death certificates, what level of clinician, and some vaccine-related items, et cetera. And so I've been having as I do, right, a number of conversations. And so there have been questions around what staffing levels look like. And so that then, I think, then Frank and I met each other, and we have talked about, what does this look like? Questions were asked of us, and that's how we arrive here today. So again, I don't think it's anything different than what we've been, in fact, I know it is not anything different than I have told you before in terms of our ability to ensure that we can staff statewide. Staffing statewide without a runway is an impossible ask for us on a regular basis. And so it is no different, Supervisor Connolly, than what I have told you before. It is always my job to look at how do we make this feasible to meet the needs of what we are asked to do. In this particular perspective, counties can have their own offices, but if they don't, we're responsible. And so I'm really just looking for that sustainability plan. Nothing different, no different conversation than we've had before.
And I know for me, I had a state senator reach out and ask if we would consider some type of partnership like that, and mentioned it, and I haven't looked at the bills, but there, I think, have been bills around that would codify some of these actions anyway, so he kind of gave me a heads up to say, get out in front so that you guys can have a voice at the table. I don't know if those bills are still out there or not.
We all like things rammed down our throat when the legislatures do that. Dr. Deol, how long have you been with us so far? When did you accept this position?
The position was accepted early December. The board signed my contract December 17th. On December 18th, I started performing all of the cases for Polk County Medical Examiner's Office, initially as a contractor from December 17th through January 29th. And then I believe it was January 30th, I started my first official day. And so I've been in the full capacity since that time, about 7 weeks.
Okay. I'm sure there's a reason why you accepted the position for Polk County. Can you just elaborate a little bit on that?
Sure. But first and foremost, I am an Iowan. I was raised by Iowa and wanted to return to Iowa. My family wants to live in Iowa. So that's what brought me here. Initially brought me to the State Medical Examiner's Office. When working at the State Medical Examiner's Office, I have no complaints about my time there. I did enjoy it. And I quickly became aware of the dynamics of the history of the Polk County Medical Examiner's Office and the State Medical Examiner's Office, particularly the year or the period where there was no staffing of a physician at the Polk County Medical Examiner's Office, which allowed me to understand some of the dynamics and the strain that that can pose on the State Medical Examiner's Office, who acts as the catch or the net when a county can't provide those services. And I see the limitations in staffing that Dr. Klein faces when handling that kind of situation. In wanting to serve a community, Iowans, whether it's Polk County or the state at large, I wanted to put myself in a position where I could do that as completely as possible. I saw an arrangement available where I could do that, increase my level of responsibility to expand my skill set. As a forensic pathologist, I feel very comfortable and skilled with my autopsy skills and testimony, but there's a lot of personnel management and then political side of things that I wanted to learn as well. Polk County offered me that. But also, I was able to take on a role where I felt like I could stabilize the relationship with Polk County and the State Medical Examiner. I don't know how long that would take. We're 7 weeks in, so I'd say this is a bit earlier than I expected for this discussion, but I think it's a valuable discussion. Because I do agree that the long-term process needs to be one that's sustainable. And I'm open to any permutation that the board wants to consider. And in my role, I see myself placed as my duty to affect the decisions of the board.
Thank you. When were you first told that Polk County was thinking about turning this over to the medical examiner's office, state medical examiner's office?
The discussion as far as some sort of collaborative effort between Iowa State Medical Examiner and Polk County Medical Examiner has been kind of ever-present since my starting with the State Medical Examiner's Office, just only in loose discussions that it needed something to provide that stability. What specific arrangement that is has always been up in the air, and it's been dynamic. So there are multiple options to be considered. In the past 2 weeks, those discussions came up more frequently, and I did meet with Frank and discuss that as to what permutations could exist for an arrangement between the State Medical Examiner's Office and Polk County. As far as what the specifics of that arrangement are, I was hoping that this meeting would provide that clarity based upon the board's decision in view of that.
Well, I don't hope don't make a decision today. This is a discussion today,
Correct.
but hope to get you some clarity soon. I'm just trying to figure out the sequences on when this happened. If you were told you were doing this, I mean, we do have a contract with you.
We've really worked in collaboration with Dr. Deol, and he brings a great perspective from being at the state and now being at the county and understanding how both work and how both don't work. And so I've had discussions with him, and it's been a very brief amount of time. This is really preliminary. It's been maybe a couple weeks, but Dr. Deol's been super helpful and what can work the best for all of the stakeholders. And so we've been kind of working those details, but we didn't want to get too far out in front of this board. And so we thought this was the appropriate time before we move any further to get it in front of you and see how you would want it to look and kind of get next steps.
Regarding the fellowship program, I know, Kelly, I talked to you, and I've also talked to the governor about the partnership that we have with Des Moines University, and we're already doing, I think even, Dr. Deol, are there students that come through the medical examiner's office now?
There are medical students that come through. Fellowship is training after residency, so medical school, 4 years of pathology residency, and then a year of fellowship
Yeah.
would occur after that.
We're working on a sim lab, as we have talked about, and so that's already in the works, so we're hoping to make sure that we get done through Des Moines University. With or without this, I'm hoping that we can work that out. I don't know why this would be something, whether he goes to the state medical examiner's office or not, why we couldn't continue that process.
So yes, well aware, Supervisor Connolly, of your aspirations around the sim lab, and we also have community rotations in our office, as we do with other community rotation for med school in our other facilities. The fellowship is different, as Dr. Deol said. I mean, it is different. You can see with the governor's bill this session, we have a very robust plan around graduate medical education, leveraging Medicaid dollars. Our work is already up with the federal government. We're in public comment time period. That ability for us to bring additional dollars in changes the landscape for teaching hospitals across the state. And again, we have real vision around how to strengthen that beyond a residency program to a fellowship for other specialization. And we have a really unique opportunity. You can't do it by yourself. We can't do it by ourselves. And the cohesion, it's the cohesion part, right? So obviously there are lots of different pathways to get to a goal, but it would be, it has to be a cohesive experience, of which in my tenure in this role, we have never been able to get to. And so yes, all things are possible, Supervisor, but up until this point, that has not been a possibility. I would always hope that we could get there, but I have plans I'd like to execute on. And there's a time and a space here with real dollars for us to be able to do it, and a wonderful and willing partner from Des Moines University.
Director Garcia, good morning, I'm Tom Hawkins-Smith.
Nice to see
Once again, thanks for being here. The only question I had, as far as, I think Frank mentioned stakeholders, how have the discussions gone with, as an example, funeral directors, law enforcement, folks like that could possibly, I think there's some concerns about timeliness versus what, our process is, doing it internally. Can you share that with me?
Absolutely. I think the way I would answer it, and certainly Frank can weigh in here as well, is that we did not want to get ahead of you all. So we have not had those conversations yet, but we absolutely want to. I have in the past, when Polk County did not have a medical examiner for a period of time, and you can see this in our volume and the charts that were provided, Dr. Klein and I both had conversations with law enforcement and funeral directors, because our timeliness did slip. Again, that was in the longitudinal study of timeliness. It was because it was a volume we were not prepared to accept at a time of heightened volume already, right? Because of just the space and time we were in as a nation. With a more sustainable plan, when you look at the rest of our timeliness, it was a blip. It was. But we want to make sure, it's incredibly important, the other partners in this work understand that and feel comfortable. And so we are both willing to go wherever you need us to answer questions and to have an open dialogue, to make sure that they feel like there is a working relationship.
Great, thank you.
As a follow-up, I do want to, so I want to drill down into this issue of sustainability, because I think that's an important issue, and I've heard it described several times. When we sat down for the first time, we talked about how you've structured this model to be the state provider for the various 97 counties in the state, and how you set up the system with the medical examiner at the county level, but then they work in collaboration with Dr. Klein's office at the state level, and how those decisions are made, and just kind of how that model is set up for the autonomy of the counnies.
Mm-hmm. I'm gonna let Dr. Klein talk
Yep.
here a bit, but I also, Supervisor, wanna hone in on that just a little bit from kind of an overarching perspective. I think the other piece and benefit here that we haven't really talked about quite yet is the chief, Dr. Klein's role, ability to really do more of that technical assistance.
Right.
Because of the volume issues in the planning, he has had to do more direct work than we would like that role to do on a normal basis. And so the sustainability plan also then achieves a higher caliber of training for for the work in our office, but for all medical examiners in all 99 counties, which we see to be an incredible benefit. And one of the bills that's going through session right now is really asking us to play a deeper role in that work. And so this also achieves some of that too. But let Dr. Klein.
Thank you again. Dennis Klein, I'm the state medical examiner, and I've been here for 20 years. So I've really experienced a lot of the ups and downs and the evolution of where we are now. And we have seen just a gradual increase in the number of cases coming to the state. So this is not a unique experience for us, but what we have experienced in the past since 2018 is these large, huge increases, and each one poses a challenge, and then we meet that challenge, and then there's another increase. And so in just addressing some of the concerns about backlogs and things like that, the things that are different now from the way they were in 2022 is in 2022, we had 5 pathologists, one of which was winding down in retirement. We had no contracts in place for locum tenens, and we had very few part-time physicians. Now we have experienced the caseload that if Polk County cases were to come to us, we've experienced that. We have the processes, we know how to manage those cases. We now have, if Dr. Deol agrees to come back to our office, which we would welcome him back with open arms, is to then have 6 full-time and hopefully recruit quickly to have 7 pathologists. We have 8 part-time pathologists, and we have a contract in place with the locum tenens. We've already contacted to make sure, can we get emergency pathologists here on July 1st or whenever we need them to start to make sure that we address that. So I just want to make sure that the board was aware we're looking at this and we're using this runway that we have now in case this is what we're going to be expecting over the next several months. As far as the system, I was arranged for a very county-centric system. So it's the county medical examiner who reports directly to the board, and we're very sensitive to that. My legislative duty is to provide assistance, guidance, and teaching to county medical examiners, and we take that very seriously. And as we've built our systems in-house, being able to accomplish the needs of doing the autopsy, we're now building out a system to provide that training. And with this new bill that's coming out, we're actually building a system where we'll have quarterly trainings for county medical examiners so that they have an appreciation and understanding of how to sign those non-autopsy death certificates, appropriate cremation permits, and how to manage their investigators at the scene. What I envision, one vision for Polk County would be that you would have a county medical examiner who would not necessarily have to be a forensic pathologist, but that they would be well-trained and be able to have good coordination with our office. And as they become more experienced and trained, they would be the ones who would be responsible for you all in the cases that are coming, for the accountability of the office, and then we would be there to provide the autopsy services as well as any other expertise and consultation needs.
Not autopsies.
Correct. So the way the profession has evolved, it's like everything else in medicine's become very specialized. And what we offer, and I think the advantage of having a state system, is that you have economies of scale. And that economies of scale does a number of different things from technology. So you have the ability to have CT scanners, x-rays that are operated by professionals who do this. You have an economies of scale of things that it takes the same amount of equipment and personnel to do 1 versus 1,000 cases. So you have cost savings, and then you also just have the expertise that builds up by doing a lot of cases in a professional way on a very high scale, just like you would have in any type of industry or medical system.
And I think had talked at one time, we'd offered to help even pay for some of your building, because you are gonna have awesome equipment. And we didn't think we needed to, double dip. But we wanted our forensic pathologist to be able to do Polk County autopsies at your facility. And that was a no-go at that time. I still don't understand why we can't do that, but, and I don't really want to let Dr. Deol go. I want to have a Polk County medical examiner for lots of reasons, and I will state them after anybody else has questions, but before you guys leave. I just think it's better for our citizens. I've heard from funeral directors, and you said you'll happy to meet with them, which is, I guess they're in the audience right now. There's a couple of them here. And I also have a couple questions for our Polk County Attorney's Office, if she'd be willing to answer a couple questions for me. So if we were to lose our medical examiner, does the Polk County Attorney's Office, is that going to stop some of your statutory duties, or will it, how will that change some of your duties as far as timetables when it comes to prosecutions on homicides or child deaths or whatever? I know, I don't know how many homicides we do a year. You probably have that number off the top of your head. I do not.
Well, like most lawyers are going to say, it depends, Angela, on the year. Some years we're lucky and we only have about 15 or 20 homicides, and other years we have many more than that. So it just depends. But that is a concern. I mean, as Polk County's chief prosecutor and top law enforcement official, part of my job is to try to ensure that the Polk County Attorney's Office and that the police departments, that our detectives, that we all have the tools that we need to hold people accountable for all homicides. But it gets particularly critical sometimes in infant and child deaths, that we have very timely autopsies performed so that we can make very timely charging decisions. Homicides don't get better with age. They don't get better with time. And so the more quickly that we have those autopsies completed and we can make those charging decisions, the better we are able to hold people accountable who harm others in Polk County. Yeah, we do routinely work very closely with the Polk County ME's office on every single Polk County homicide. I've let the board know that I'd be happy to have Megan Guns, who is our bureau chief of the bureau that prosecutes particularly sex abuse cases and child deaths, that she would be happy to come and explain in more detail just how important our relationship and our really close relationship is with our medical examiner, and to explain the challenges that we've experienced when we haven't had a dedicated, in the last few years, when we haven't had a dedicated Polk County medical examiner, and how much better things can go for us when we have. Even just in the last couple of months, having Dr. Deol to work with has just been incredible. It's been a breath of fresh air. I would go so far as to say, I know it's been early days, but Dr. Deol has absolutely impressed us at the Polk County Attorney's Office with his professionalism, his knowledge, his just willingness to be of service. He recently came to the Plexa. We have monthly Plexa meetings. That's the monthly law enforcement meetings for the law enforcement chief, police, myself, Department of Public Safety, Commissioner Bayans, et cetera, the state troopers. And he went to that Plexa meeting to introduce himself to all of law enforcement chiefs and to say, hey, how can I best serve you? It's a new day here. I'm now the Polk County Medical Examiner. I know it's been rough for a few years. Let's get things going in the right direction. So we were all extremely happy to have such a wonderful new medical examiner and very excited about the future and the way that he would continue to build the office. In regards to kind of the sustainability questions and issues that have been mentioned, my understanding just from yesterday's board meeting is that the county has millions of dollars in reserves, and I understand reserves are reserves, I get that. But I believe that this investing in the Polk County Medical Examiner's Office would be a very worthy investment of some of those dollars that we in fact do have available to us in Polk County. At least that's my understanding from listening to the budget discussions yesterday. Polk County is not getting smaller. We all know that. Just a couple of years ago, we had less than 500,000 people. We now have over 500,000 people. Just in a few years, we're now up to 505,000 people approximately, and growing by the day. And the more that we grow, the more that we're going to need our own Polk County Medical Examiner, not less. Those long-standing relationships are critical. I would ask that if this plan ends up going forward, because it certainly is up to the board whether they choose to do that or not, that we do, as Dr. Klein had mentioned, I would love it, and I know, I feel pretty confident speaking for the chiefs of police in this county on this point. We would love to have a dedicated Polk County person at the state. So if it is possible that we would love Dr. Deol to be our point person at the state medical examiner's office if in fact this plan happens. That would be great. And the reason that's important is because our prosecutors learn to work with a particular medical examiner. And every medical examiner has a little bit different way they testify, a little bit different things that they feel are important. We have to kind of train them on what's important for them to testify about in a homicide case. And so the more that we can work with a particular individual, the better it is for us, and we get to know one another and we have a better working relationship. So that's really important. I just really believe that local government exists for a reason. Local government can be the most responsive to localities and to the people of that locality. And so, to that end, I appreciate the opportunity to say a few words and to advocate for what's going to serve the Polk County Attorney's Office best and therefore the people of Polk County. Thank you.
Dr. Deol, since you have unique experience with both entities now, maybe a little more limited with Polk County, the concern, we build out this runway, the concerns that the county attorney raised, do you find any of them valid? I mean, we build this runway out, or Dr. Garcia, we build this runway out, we all work together, we find a system that works, right? I mean, she's, making an argument for us to build our own kingdom here at millions of dollars, but why can't we collaborate? Dr. Garcia or Dr. Deol, tell me why we can't collaborate. Why can't we build this out to work with the objections the county attorney just raised?
I think the argument depends specifically on what concerns are being addressed. In considering the various permutations of what the Polk County Medical Examiner can look like in the future, and to what degree of collaboration with the state medical examiner, I think every option has pros and cons and appeals to different stakeholders differently. So it comes down to a dynamic situation where you're kind of weighing multiple things at once. If you're talking about just a strictly fiscal argument, we can discuss the permutations and different options. If we're talking about sustainability, representation for stakeholders, I think those should all be addressed specifically, and I do my best to answer where I can.
But we'll all continue to work forward on finding that answer. And again, the economy of scale, being able to get the fellowship program going, building that pipeline into Iowa, all of Iowa is going to benefit from this because we're going to be creating the volume needed for the state medical examiner's office.
I do think one area of concern that I want to raise is that in all the ways that we look going forward, and this relates to the fellowship program as well, is that the linchpin can't be a single person. So if the linchpin is me as the chief medical examiner having endurance and personal stability, health that allows me to continue this in this capacity, I have confidence I can provide that as long as I maintain health and endurance, but neither are infinite. And I think that in service of the community of Polk County, I took this role to provide stability in some manner. Another forensic pathologist, growing population of 500,000 people, about 1% of those deaths should be analyzed by the medical examiner's office, and then currently we're autopsying or doing postmortem exams on 10% of that 1%, so about 500 per year. With a growing population and aiming towards reaching standardization from the National Association of Medical Examiners. I expect that number to increase past that 10% of the 1%, where we may be looking in a few years towards 600 cases. At that point, we're reaching a volume where I think we need 3 forensic pathologists, where accommodating for the dynamics of health and sustainability and other, how long people stay in their role, reaching a point of sustainability in that permutation. But I'm happy to answer questions about any other dynamics as well.
Let me ask a follow-up. Kimberly sat down, so maybe somebody else can take this one. During that period of time when we had a high volume going to the state office, did we have a medical examiner point person for Polk County? No, so that would be a big change from what we're looking at doing now.
Yeah, so it was end of October 22, and we had about a week's notice that the medical examiner at that time in Polk County was doing their forensic autopsies left, and we started receiving those cases within a week's notice. There was a period of about 2 to 3 weeks without a medical examiner, so we provided that emergency service, and then a physician was appointed as a county medical examiner for that period of 2023 until the next forensic pathologist was hired by Polk County.
But Dr. Klein, did you provide anyone in your office for the county attorney at the time? A specific designated?
No, and so with all due respect, I think the most efficient and best way to operate an office is that you have standard operating procedures such that it really doesn't matter which board-certified trained pathologist performs the autopsy. We can't guarantee, even if you were to have a designated person, that person does have to take vacation, they have to get continuing medical education, they do get ill. So it's much better to have people who are on call, they can plan their schedules, sometimes they have to be in court, that you have a standard operating way that you perform autopsy. So it really doesn't matter which pathologist, as long as they're trained, performs that
Right.
autopsy.
And I apologize, I might not be articulating well. If we were to move forward, we're looking at continuing to have our own medical examiner as a point
Yes.
person. Did we have that before? When all our autopsies were going to the state, did we
Yes.
have someone here?
Yes.
And there was a breakdown of communication, so we would have something to work towards, like better communication on that, or, no?
No, I think so. So every county,
Okay,
there was a brief period of time where it was filled in because you didn't get anyone.
okay,
Then you hired a medical examiner.
okay,
Our office continued to do autopsies.
sure.
To Dr. Klein's point, and for what it's worth, I wanted the physicians to answer because I think their perspective to your question, sir, is important. But I've been spending a lot of time working on a healthcare strategy for the state in other aspects of clinical work, mainly focused on maternal health and OBGYNs and doctors who deliver babies. And what I have learned, which is no different than what I've heard from our team of forensic pathologists over the years, is it's real lonely to be a one-man shop. You train as a team, you expect to go practice as a team. And humans have life events. People get sick, they need to go to weddings, and you cannot build, and it's single points of failure will break your system. And then, as I've said a number of times, our system is not built to just take the cases. So a week's notice crushed our team. Then we run the risk of burning out our physicians, and then as a state, being in a worse case, right? So make their decisions. I absolutely, I hear the county attorney, I disagree with what she's saying in terms of what she's in charge of shepherding and stewarding. Like, those are real things. From my perspective, and I look at this across the entirety of our system as we think about economic investments or policy investments, and then my own team, which is quite large, is that you really do need to try to eliminate single points of failure to have a system that is high quality and runs on time. Would it be ideal to have point people everywhere? Sure, of course. But much like delivering babies, I happened to deliver my baby with my OBGYN. She happened to be on call. But most people don't. Why? They train as a team, and the person on call delivers the baby. So when we look at other professions and different types of work, like, that's a sustainable model because it keeps the people who do this highly trained work whole. and able to do it and well-trained, so you expect the same outcome no matter who you get. Certainly, and we would be happy to sit down with you, Ms. Graham, around what that looks like so you have confidence in the work and deeper relationships, but we're talking about ultimately 7 docs, not 70 or 700, right? It's not like you're just gonna get some ticket person. I mean, it's still a small team, highly trained individuals who are right here in Polk County. So I think we could expect that that relationship could deepen under the right circumstances.
Dr. Klein, I'd like to talk about the economics of all of this, because that's one of the things that has concerned me as did in of the facility, and saw your proposal for the addition that the $36 million that's going to be invested in this addition to a state-of-the-art facility. As I understand the process, and having walked through it with you, you use a process as it relates to bodies come into the facility, and they're moved through a process, and that process is very important to allow you to reach the volumes that you're reaching. You're doing 6.2 autopsies 7 days a week, 365 days a year. You're using a collaborative approach with a team of doctors who perform autopsies in the morning and then share findings as a collaborative group in the afternoons. Help us understand, just from layman's terms, what that process is, and what we would be getting, and then what that would cost to replicate at a countywide level for a standalone facility, and how would that have to be staffed future forward?
Right, a standalone facility does increase the cost, not only for your initial investment, but also for ongoing operating expenses. So right now with the Broadlands, you have a lot of these ancillary type of services that would then have to be absorbed into a standalone facility. An example would be someone who's there to receive the bodies and release the bodies. You would need security systems, and you would also need radiological equipment. All these things have to be purchased and maintained. And there's economies of scale with all of these types of items, where you need one person there to receive and release one body, or 20 bodies. It's the same amount of infrastructure and staffing that you would need. So in order for Polk County to go and do another standalone would be a lot of redundancy of purchases and staffing. Going through this building expansion, I do have a lot of sticker shock with some of the prices now. Autopsy tables in the orders of tens of thousands of dollars. Anything with stainless steel, with HVAC now, it's very, very expensive equipment and has to be maintained. So anything we can do, I think, as a state together to try to be efficient and use our monies to leverage these areas of economies of scale makes me feel much better as a steward of the taxpayers' money, and I think just for the quality of work that we can do by working together under a single robust system that operates under a standard system.
I'd like to ask Dr. Deol a question, and then just real quickly, did I read somewhere that the state's already dipping into reserves?
Not dipping into reserve for this project. This project is fully funded.
I know your project's fully funded, but it sort of makes me nervous, you know, when you talk about sustainable, is the state's dipping in reserves, and we're relying on, our constituents are gonna be relying on, and putting our community in the state's hands. That's one of the things I'm a little nervous about. What does Polk County need to make Polk County sustainable in your estimation? What would your goal be to hire a deputy, ME? What would we need to do
And would it get us to being accredited? Let's add that part to it.
Yeah.
to avoid the single point, you know, that we're all talking about here anyway?
This is relevant to conversations I've had with Frank about what this would look like if we were an independent agency. Organizational chart would change a little bit. So we would have a county medical examiner represented by whatever class or qualifications they need based upon state code, chief medical examiner, and then a deputy chief medical examiner. So the chief medical examiner and the deputy chief medical examiner would both be forensic pathologists. I think that's what we would need staffing-wise right now, based on our current number of cases. When we strive to achieve accreditation from the National Association of Medical Examiners, we're looking at needing a new facility. And some of the facility requirements could be retrofitted into an existing building or facility. Some of them might be easier if they were built from the ground up. And then when we're talking about the jurisdictional changes that'll come with that and the increase of bodies, I think we're looking at a third forensic pathologist. And whether the county medical examiner role is shared between those forensic pathologists or if it's still a separate FTE, I can't be certain. We would also need to increase our staffing in the autopsy suite. We currently have one full-time autopsy assistant. We would need at least one more. I think there could be an argument to be made to increasing that, especially if we're gonna need to start doing cases on the weekends due to case volume increases. In looking at building and facility changes, without doing the ground up work of seeing what it would cost for land and materials and contracts, I did try and look at other agencies relevant to or similar in size to our population. Midwest was my focus as well, and see what they had spent and tried to limit it to past 3 to 4 years. In looking at that, we have the Iowa Office of State Medical Examiner. Their funding is about $33 million for that expansion project. Milwaukee, Wisconsin invested $22 million in a facility. They house, I think, at least 4 forensic pathologists, and they serve an area of 800,000 population. Escambia County in the 1st District of Florida, right at the Panhandle, they cover 3 different counties, a total catchment area of 800,000 people in their population. They staff 3 forensic pathologists. Their facility was built in 2022 at the cost of $16 million. Johnson County, Kansas, they recently built a facility, I think it was completed in 2024. They staff, I believe, 3 or 4 forensic pathologists, and that project was $22 million. And Pima County, Arizona, completed a facility in the past couple of years at the cost of $45 million to service a population of 1 million people. And they staff 8 forensic pathologists.
Okay, sounds like you've done some checking for sure. Of course, that's what we hired you for, and we told you we were gonna look for a new building.
Mhm.
And at least that's why we put, originally, we've been sitting on 7 million, set aside for that, plus we knew we had reserves that we were gonna look for a new building, so, or build. When we hired you, I think we told you that, is that correct?
Yep.
That's what I thought.
So I think the lowest amount I heard from you was 16 million for one of those as it was completed, right?
Correct.
So much like the state, we'd be looking into our reserves as according to Kimberly Graham.
Well, and that was part of the genesis of the conversation is that really viable? So as Dr. Deol and I worked on what it would take to get us where we need to be with the cost of the building and staffing, is it viable with the challenging times we have? I mean, I would caution the board to dip into our reserves, which we're required to maintain at 25%. But it does go back to the sustainability point, and it's been unfair for Dr. Deol, who's working 100 hours a week, and so there's the burnout factor, and there's also to consider Dr. Deol could leave. And so again, we're facing the same problem in perpetuity if we don't address it, if we don't take it to scale, have additional docs. The desire of one doc, but I know our folks like to work with a specific dispatcher or a specific detective. Everyone wants to work with Detective Pullman, but he's not always available. And so as long as you have a qualified pathologist, I don't see, I just don't see an issue there. And in relation to the chiefs and sheriffs, I have spoken to them and they understand what we're doing and why we're doing it, especially when you consider the significant cost savings. So, you know, we do have some of them here, but I'm not gonna put them on the spot, but I can tell you they understand what this board is considering.
Well, I'd like to hear from a couple of them, whether it's today or down the road. I'd like to hear from the funeral directors, and I'd like to hear from some of the chiefs, how they feel about moving the medical examiner out of Polk County and into the state, because they deal with them also. I just, you know, for our constituents, I'm thinking about the constituents and how long it has taken previously. in the past, I've heard, you know, stories. I've got one I know personally, Warren County. It took almost 3 weeks, and it was a suicide, shot in the head. They had to do an autopsy, because I guess you do an autopsy on every single body that comes to the state. I don't think we do in Polk County. And it took almost 3 weeks before they could actually bury their nephew. I just think that's outrageous. Now, maybe it was a special circumstance, I have no idea.
So I was wondering, is it an outlier? And do you give priority, Dr. Klein, to certain cases? Because again, Kimberly Graham, like kids or babies when they die, like autopsies don't get better with age, right? Do some get prioritized differently?
Right, and I think, again, that was in that period of time when we had 1 week notice and our cases increased, and we didn't have nearly the personnel and infrastructure that we have now. As a person who talks with individuals who've had the worst day of their life, that's in the back of my mind. So that is, other than making a mistake, that I would say the worst conversation to have is with the family reason. We do have a general against the fair income is that first come, first serve, even when we were that backed up. And what I could assure family members, when we get as make errors, we do this correctly. We hand it with respect, care to make sure we get the answers. We do that as the person comes into the office. Now, if there are homicides, those of course are high priority. There's evidence that's at stake, and individuals who usually are babies, there's medical reasons to do those. So those usually are done immediately the next day available that we can do them. I think the infrastructure from what it was in 2023 to what we have now are significantly different, and we also have some runway to approach that.
Dr. Deol, you were very kind and invited me out to visit your location, and I'm sorry, I haven't made it there yet, but I have made it to the state, and I'm still coming to see you, okay, I promise. But what's the difference? What would I see between the two that's different? How many autopsy stations do you have where you are? And just walk me through
So
briefly.
the current state facility has 5 autopsy tables. They could perform 5 cases simultaneously.
No, I've seen theirs.
Oh, so, and Broadlawns, we have 2 tables that we can accommodate. We have a single cooler that can hold approximately 8 bodies. We share that space with Broadlawns, so if there are people who pass away in-house, then they'll take up one of those spots. We're kind of constantly at a balance of making sure that we're not overflowing there. The facility is owned and operated by Broadlawns Medical Center, and so that's for our autopsy and morgue area. We have a bay where we can bring in 2 of our trucks at a time to privately unload people who are under our care without view from the outside public. And then we have offices that are about 1,200 square feet total, and that's to house a staff of 13 right now.
And are you the only doctor currently?
Yes, I am currently.
Because in the plan to get accredited and what you need in the future, you had 3 to 4 doctors necessary, so there'd be quite a ramp-up period, extra cost, ongoing cost there too. Yeah, no, I saw the facility with the 5 beds and the x-ray machine. Do you have the x-ray machine?
So we contract that service through Broadlawns, and the x-ray technicians at Broadlawns bring down a portable x-ray, and they perform the x-rays as needed, case dependent.
Okay. Do you have the CAT stand that they're adding? I mean, I was really impressed with what the system was. You pull the truck into the bay, there's a nice privacy area, there's the cooler, as you talked about, right? For the evidence station, everything was very bright and sterile, and that's what I have in my mind when I go to visit your space. I'm trying to figure out.
And I think that's what I think about when I consider meeting the National Association of Medical Examiners standards. So they're very clear, long list of things pertaining to each wing of the operations, whether that's investigations, receiving questions about jurisdiction, performing autopsies, when we hold and store bodies, what facility quality we need to meet for that. To meet the operations that we're currently at right now to those standards, I think it would require significant investment and modification of the facilities that are housed in the hospital to a point where it's probably better to have a discussion about where are we going next. rather than making that large investment in change to the facilities that there may not be opportunity to pursue.
The Sheriff, I see you standing there, and I'd like you to step up if you would, and share your thoughts.
Well, just a couple quick ones here. First of all, probably no secret that Dr. Klein and I don't always agree on everything. One of the things that we lost when we lost our medical examiners originally here in Polk County, we also lost the ability of the death investigators to go out and assist in vehicular homicides when it comes to blood and everything, because folks something a little bit different than we do in the county. So my concern would be is if we lose the doctor to the state, or if we merge, would that be something that we lose, or could that be something we could work on? And because I know there's two different needs, and I understand Dr. Klein says that his people were not trained to work on live bodies, where our people were trained. And so that would be one question that I'd have to throw at you, and I know you're getting blindsided, Dr. Deol, because you and I haven't even had a chance to chat, but.
Yeah, and that's not we got a bigger issue to fry right now, but I suppose he can answer that question, if he can.
Well, it's a big issue if it's one of your family members, and I can tell you right now that former Supervisor Van Ort's daughter was involved in a head-on collision. I'm just trying to tell you that.
Not a big issue. I realize.
It's important.
We've been working on it for 2 years, but that's not what the issue is today.
If I may, Sheriff, I remember that conversation, and I was not the county medical examiner. When the Polk County medical examiner was leaving, the investigators were extremely stressed and were looking for leadership. And one of the things of their pressure points was doing live patient draws. I had a few concerns because that's outside my practice, and I felt that my liability and my scope of practice, that was outside of that. So I advised and brought to the attention of the county medical examiner at the time that I had some concerns about that. What the decision of a current or future Polk County medical examiner, that would be up to them. My advice would be the same, but that would really be their decision, as would managing the investigators who actually go to the scenes, and all non-autopsy would really be under the direction and ability of a county medical examiner appointed by this board.
Right, and what I was trying to get to is, even though we'd have our own medical examiner, he'd have some freedom to make his own decisions, even though he's working with you in your facility, which is an accredited facility, which we don't have. Is that correct?
Yeah, I see it as really having your cake and eat it too. You get the expertise, the state-of-the-art facility, you get the full professional collegial power of having multiple physicians. You also have local control and local decision-making with your county medical examiner.
So basically, they get the best of both worlds.
Exactly.
Okay, and it's kind of like what we do when we train folks with firearms in the new facility that you guys got us on the machine. They can't afford the machine, we help them train. It works great for everybody, and I'm just hoping that we didn't lose our identity if this merger would take place. That was my main question. So, thanks.
Can I hear from the funeral directors real quick? I know it's over an hour, but I'd like to have somebody speak to that. I thought you were with the state. Sorry, I would have recognized you sooner. I don't know who you are.
My name is John Jacobson. I've been a funeral director here in Des Moines for 12 years. Previously, I've been in another state that was on the coroner system. I've also been up in the Twin Cities, which is a lot larger metropolitan area. What you are proposing right now is taking Sam away from Cheers and putting him in an Applebee's and saying, oh, it's the same thing. It's not at all. If you ask me point blank what the residents of Polk County are going to get the best service from, Polk County Medical Examiner, as opposed to the state. Nothing against the state does a great job. But what I'm saying is exactly like you said. I've had to sit across from families of teenagers who took their own life and said, it's going to be 2 or 3 weeks. Well, are they viewable? Can't tell you. Polk County Medical Examiner, I can call a medical examiner investigator. I can talk to an autopsy tech. John, I'm sorry, he's just not viewable, in my opinion. And I can then have a real conversation with the family. So state does an excellent job But if you're looking about what's going to give the best service to Polk County, it's Dr. Deol and Polk County Medical Examiner. Now, in those 12 years, I've seen a lot of Polk County medical examiners come and go. The discussion to have this done should have happened 7 years ago, okay? You finally got a guy who's got the personality for it, the bedside manner, the professionalism, and you want to cut his legs out from him before he even gets a chance to cook. Like, I can tell you, I've had some tense moments with former Polk County medical examiners who had quite the ego. This guy is here to serve Polk County. His medical examiner investigators are here to serve the county. And I think absorbing that into the state, well, yeah, we give a runway to it. It's not going to be the best for your families, for our families in Polk County. And I'm saying that from firsthand experience of when I get a call from somebody saying, hey, by the way, I just want to make you aware of this. When you're doing your preparations to make that person look good for their family, I don't get that from the state. State's great, but it's more levels of bureaucracy. So, end of the day, for your families, maintain it and let this guy cook because he is the right guy for it. And I have seen 4, 5, and you can tell right away too, like, okay, how long is this gonna last? The guy.
May I ask 2 follow-up questions? One, Dr. Klein, we spent some time talking about accreditation and the list of 300 plus whatever you have to do to be accredited. And if I remember correctly, one was you have to have 90% of your cases out within 42 hours and then another percentage of that out within the next 72. So based on that poll, because you'll probably have a response, are you finding this like multiple times, or is this 1 or 2 bad incidences because we can all have some bad incidents?
The state's
right?
gotten a lot better, okay? There were a lot of instances previously where there was understaffing, things like that. Not knocking the state at all. They do fantastic, and especially the caseload they handle. But to make another analogy, right now Polk County has the family grocery store, okay?
Okay, so if they have that landing run up, it first of all, may have been some isolated issues before. We're seeing much better.
Delays?
What?
Are you talking about the delays and disputes
Yeah.
being turned around?
There were some issues before, it's gotten much better, and maybe with this
Yes.
landing ramp, or landing pad, or whatever we're calling it, runway, we can get up to better. Okay, my other question, if we were to do this, and we have our own Polk County medical examiner, you would have somebody that you could actually contact and be that conduit. Would that be correct? I mean, can we make that into the arrangement so that our funeral home directors are able to serve our constituents?
Yes, just a couple of points on that. So a majority of your cases are not autopsied, so it would be business as usual with your county medical examiner. The other thing about bureaucracy, any of you tonight, you wake up for your midnight snack and you were to call 515-725-1400, you will get a person. You will get a person no matter what time you call.
Or medical exam.
Oh,
That's our medical examiner main line. So there's always a person available, and you have a forensic pathologist available on call. We call within 10 minutes.
You'll get a person after going through a prompt. It's 5, by the way.
I appreciate that. Tonight.
So as far as, you had questions about accreditation. So accreditation is a very important process that looks at over 300 different line items of specific things. One of them is performance standards. So it's how long does it take you? What's the percentage of cases that are completed within a certain period of time? So it's 48 hours and 72 hours, the 2 benchmarks. You need 90% of your autopsies to be performed. So in 2024, we have a sheet for you all to look at, but you can see that the performance, once we were at a stable position of staffing, we were at over 90% of cases are completed within that 72 hours and nearly 90% for the 48 hours.
Thank you.
Thank you.
Do we have a contract that we've drafted?
No.
No. just
Okay. Well, I mean, everybody's been out to Ankeny and taken a look at what they have to offer. I'm just wondering if we've got a contract.
Have you been out to
And-
Ankeny? You need to go. It's
I've
really
been
good
there
Okay.
a couple of years ago.
Angela, if we could hear, you had asked to hear from this young man that's one of the funeral directors, and then I think we want to find a way to wrap this meeting. So, please.
My name is Alex Wright, General Manager at Caldwell Parish Funeral Home. So my biggest concern would be, again, the timing of the medical examiner, making sure that that is not extended. I think now they're at a point where 2 days, 3 days release, that's okay. That works for us, that works for our families, because our biggest goal is to make sure that our families are served well and within a timely manner. Because I have had that conversation with a mother who lost a child, of why it is taking 2 weeks for her to be able to see her child and delaying that grief and that closure that they deserve. Again, this was 2020, you know, it was right when pandemic was starting to shut everything down. So I understand the circumstances on that, but I want to make sure that we don't get back to that point because of an increase in workload that they're taking on. My other concern would be currently now, like, Polk County investigators do their own transportation, you know, when the death occurs at a scene. Funeral homes are not becoming overloaded with additional workload to transport deceased like it is in other counties. We have funeral homes in Madison, Dallas, and Dallas County. So we do get called out to the scene to make those transportations to the state medical examiner's office. Now, Polk County is a whole kind of different beast when it comes to that with the number of caseloads. So making sure that the appropriate process is still there, because I don't know if the funeral homes would be able to handle that caseload, if our directors would be able to take on that responsibility there as well. So just making sure those couple of issues are addressed are my biggest concerns.
Thank you for your comments, and appreciate it.
I just wanted to make one more comment before you wrap it up. I think the shining star of this, Dr. Deol, like, the state wants you, the county wants you, the funeral home directors want you. You've been with us for 7 weeks. You've made a very positive impression. So thank you for at least taking time to consider this option and continuing to work with us, and of course, inviting us out to see your facility.
Obviously, this is a challenging decision for this board moving forward, and I appreciate all three of you being willing to come and talk about this with the board. The challenge around the medical examiner's office has eluded us at Polk County since I joined the board in 2018. I've seen constant turnover, constant attempts to recruit. I've seen medical examiners burned out continuously. The system that we currently have is not sustainable. I do know that. I do know that the pressure on local governments is going to be intense over the next decade. And as we look at the proposal for serving the medical needs of the state through the medical examiner's office with this $36 million expansion on your existing campus and the state-of-the-art technology that will encompass, to think that we can replicate any part of that or a piece of that, I think is naive on the part of anybody that has priced new construction of facilities or even modifications of existing facilities. So I think there's a lot of reasons to pursue further discussions. I think that this was a start, and I think that my hope would be that we will continue to have these discussions and that we will continue to seek input from law enforcement, from the county attorney, from the medical directors, and that we work through a model that makes people comfortable, and that ultimately delivers a higher service to the taxpayers at a lower cost. And so I think that's going to be certainly what I'm going to request that you take charge of, Frank, and that this be something that we continue to pursue.
Okay, I'll do that.
I'd like to make sure we see all the documents that get prepared, and I still don't understand why we cannot partner as we mentioned before, about the cost on helping with the facility and still have our own autonomy with the medical examiner?
So Supervisor Connolly, to refresh the other members around that conversation, as you heard Dr. Klein say, there's a standard practice, and again, there are different pathways to get to an end goal, but at that point in time, in our last conversation, there was an unwillingness to deviate, or rather, to conform to the standard practice of the medical examiner's office. So we have been historically open to partnership, but if the space is shared, the common practice by the chief medical examiner needs to be observed. And that was the space where we could not come to terms.
Very good. Thank you all, and we'll be in touch.